the knowledge giver on understanding autism, how to guide your child on autism spectrum to learn. I am Deepa Watts, and child and adolescent psychologist who will be covering this course with you. So let's begin. So our course starts with the contents, and it is divided into 4 parts. So initially we'll be covering the autism puzzle, helping you understand what exactly is autism. So demystifying that for you. And then we'll be going on to understanding your own child, because every autistic child is different. So understanding your own child is very important. We'll be covering that after that. And then we'll be going on to building blocks of learning. What are the blocks that are required for our child to learn? We'll be covering those building blocks then. And lastly, we'll be covering prerequisite skills for learning. So learning begins with certain skills. What are those? We'll be covering that in our 4th part. So let's begin. So part 1 is demystifying the autism puzzle for you. So in this, we have 5 subtopics. Topic 1 is definition of autism. What exactly is autism? We'll be covering that here. Then there is topic 2, which is core characteristic of autism variability or levels on the spectrum as per DSM-5, that is Diagnostic Statistical Manual, 5th edition. And then we'll be covering in topic 3, importance of early identification and intervention. It is very important to identify and intervene as soon as possible for our child. And then we'll be covering red flags during early developmental years in topic 4. And topic 5, we'll be covering theory of the mind. So let's begin with the definition of autism. So autism is a lifelong, non-progressive neurodevelopmental disorder typically appearing before the age of 3 years. The word autism means a developmental disability significantly affecting verbal and non-verbal communication and social interaction. So what is autism? It is a lifelong, non-progressive neurodevelopmental disorder. So it is related to the neurodevelopmental circuits of the brain, and it is a lifelong thing for our child. So we need to be with our child throughout their age, and it is usually something that appears before the age of 3 years. And autism basically means a developmental disability which significantly affects the verbal and non-verbal communication of our child and their social interaction. So next, as per autism diagnostic criteria, DSM-5, it is divided into several subparts. Let's cover part A. It is persistent deficits in social communication and social interaction across multiple contexts. So our child has difficulty in their social interaction and social communication in multiple contexts. What could be the difficulties that our child is facing? They may have social emotional reciprocity difficulty or deficits. They may have deficits in their non-verbal communicative behavior in social interaction. They may have deficits in developing, maintaining, and understanding relationships. Part B, we have restricted repetitive patterns of behavior, interest, or activities as manifested by at least 2 of the following. So our child has restricted or repetitive patterns of behavior, interests, and activities. We have kids who have stereotypical or repetitive motor movements, use of objects or speech. They may have difficulty in flexible adherence to routine. They just want sameness in their routine. They have rituals that they want to follow, and they have specific ways of talking, verbal or non-verbal behaviors maybe there. They may have highly restricted or fixed interest that may be abnormal in intensity or focus. Our child may be hypo or hypersensitive to sensory inputs or unusual interest in sensory aspects of the environment. So sensory difficulties are there as well. Part C is where symptoms must be present in the early developmental period but may not become fully manifested until social demands exceed the limited capacities or may be masked by learned strategies in later life. So that is very important. And part D is symptoms cause clinically significant impairment in which domains? Social, occupational, or other important areas of their life. And developmental disability or a global developmental delay. So that is DDD.
It is important to make sure that these symptoms are not better explained by either intellectual developmental disorder or global developmental delay.
So it is important to understand that our child may have comorbid conditions as well. So there are autistic symptoms, and then there are other symptoms that may also be there because of other comorbid conditions. So we need to specify whether it is with or without accompanying intellectual impairment. We need to specify if the child has any other acquired language impairment with it, and we need to see whether there is associated with another neurodevelopmental, mental, or behavioral disorder, whether it's with catatonia. We need to see whether it is associated with a known medical or genetic condition or environmental factor. So we need to see those things as well. So if there is another comorbid condition that our child has, we need to see that as well. Then coming up to variability on the spectrum as per DSM-5. So there are different levels that a child may be having. What are these levels? So level 1 is where our child requires support, little support. So they have difficulty in initiating social interactions with others. They have problems with organization and planning. They may have these difficulties which will impair their independence. So that is where they require little support from us as parents. So then comes level 2. Level 2 is where they require substantial support. So they have limited social interactions with others, and they have very special or specific narrow interests. They have frequent, restricted, repetitive behaviors, and that is where they require a little more support from our side. And then comes up level 3. Level 3 is where they require very substantial support. So they have severe deficits in verbal or non-verbal social communication skills, and they may have great distress, difficulty in changing actions. They may have difficulty focusing on specific things. This is where they require substantial support from our side and intensive intervention support from specific therapists. Okay, next slide. So, importance of early identification and intervention. Why is it important to early identify and intervene and help our child? Because we have so many social learning opportunities at smaller age. So before 5 years of age, we can give them more learning opportunities, which will lead to better prognosis. That means their symptoms can be reduced, they can be modified, changed as early as we intervene. And there is another concept, developmental neuroplasticity. So our brains are developing, and changing pretty fast before the age of 5. So if we intervene at this specific age, the neural circuits are forming, which can be modified, which can be changed, and the child can be helped. There is delay in secondary symptoms. We can delay secondary symptoms. We can delay the maladaptive behavioral development. So if the child is frustrated, because of the sensory issues, and they learn specific behaviors to deal with it, which may be maladaptive. So we help, delay or reduce the secondary symptoms in our child. as early as we intervene, the better we are able to help them and seek right kind of services and interventions. So we may just observe that a child has learning difficulties. We do not understand our child that well, if we do not get the identification done. So we think that the child just requires learning speech. So we just give them speech therapy. But they may benefit from behavior therapy, they may benefit from occupational therapies because of their sensory issues. So, if we do not have the proper understanding, the identification, getting help from others, specific therapists will help you understand what kind of services does my child actually need at the specific age, and the right combination can be provided to our child. That is going to help them a lot, trust me. Okay. So, last is dropping the let's wait and see attitude. Let's wait and see. My child is still young, if he's not speaking that much, my child is shy probably. We'll just wait and see for a little more time. Let them go to school first, and then, probably they'll interact with others. Let's just wait and see. That is not an attitude that as parents we should take up. We should definitely drop that attitude and work now, intervene now, help our child right now. Next is red flags during early developmental years. So there are specific red flags that we can identify and we can understand, okay, my child requires help. If these things are not happening, these developmental things are not happening at specific age, I should probably pay more attention to my child and see. Okay, so let's start with infancy. So in infancy, just observe whether there is social smile. If it is not there, it is a red flag. There's no babbling there, it's a red flag. The child should be able to use certain gestures. If it's not there, we need to look at that. And if there is any loss of speech that is happening, then we need to definitely look into that. Coming to toddler, there is lack or delay in spoken language. The child does not speak. This child does not, is able to communicate with you that effectively. They have very limited use of gestures. They have probably inappropriate or limited play. They have limited interest in other children. They just like to be with themselves alone, not interested in other kids. They have sensory avoidant behaviors. So sensory difficulties are there, which is affecting them, and it's probably sometimes even lead to tantrums. Extreme tantrums are there because of that as well. So we need to look into that. Coming to preschool. So here we need to look whether our child is able to do joint attention and imitation. If it is lacking, we need to help them out because it is very important for learning. Joint attention should be there, imitation should be there. These are very important skills. Whether there is delay in communication skills, so the child is not able to communicate their needs, they're not able to communicate about their day and everything like that. So it's a red flag for us. Whether there is difficulty in playing with toys as intended. So probably the child just likes to put all the blocks in a specific line. That's how they like to interact with the toy. They do not join them or make some design out of it or house out of it. They just line them up in a specific way, line them in a specific color or something like that. They do not understand how to play with toys. They are not able to explore different ways of playing with the toy. So we need to definitely help our child in that specific domain. Then we need to see that, okay, this is a red flag that is coming up. Whether they have restricted areas of interest, so they just like specific things, and very they do not like to interact or deal with other things, just specific interests, just want to do those things. So then probably these are red flags that we definitely need to look into, and help our child. These are just certain examples. There could be more. Just observe your child and see, as per the developmental age group, How is my child specifically behaving? Does my child have difficulty in specific areas? Do I need to intervene or help out? Learn them so that they can learn those skills. Now let's come up to theory of the mind. So what is theory of the mind? Why is it important for our autistic kids or children with autism? Because it is an important social cognitive skill that helps us understand others' perspective. So if we need to understand others' perspective, then we need to know the theory of the mind, because this is very important skill that should be there in our child. And this helps us shape our responses. So the way we understand others' perspective, we behave accordingly in specific situation. So that is why it is a very important skill where autistic kids have difficulties and they require special help for that. And we help our kids in that particular domain. So there is a test that I would like to describe here, which is very important to understand this concept. That is Sally and Anna test. So there are two dolls that we have. There is Sally and there is Anna. So Sally has a basket and Anna has a box. So Sally puts her red ball into her basket and then she goes out of the room and leaves Anna alone. So Sally has gone outside. So only Anna is left in the room. So Anna takes the ball out of the basket and she puts it in the box. And then she goes outside. So when Sally comes back, she wants to play with the ball. Where will Sally look for her ball? Would be our question to our child. So Anna had kept it in the box, but Sally had originally kept it in the basket. So as per Sally, she should be looking it into her basket because she's not aware of Anna keeping it in the box. She was not around. So this is a specific perspective that that is definitely something that a child needs to understand, that Sally should be looking it in the basket and not in the box because she's not aware of it. So our child may have difficulty understanding others' perspective. So this is a test that is done. So as per them, there's only one way, that is my way. So this can create difficulties in finding different solutions to a problem, novel ideas, coming up with novel ideas, and there could be negative social consequences because sometimes we need to understand how the other person is, how the other person might take our response. So should we be very direct? Should we that may the probably the person may not feel nice if we say specific words. They may not be socially appropriate. They may feel hurt. So those kind of things, if the way if we respond in that way, so it can lead to negative social consequences. So it is important for us to understand others' perspective. It is a very important social cognitive skill that we need to teach our children with autism